Welcome back to the Southern Scene. You know, here on the Southern Scene, we're all about making you feel good and finding those ways that you can feel your best. And today I have with me one of our experts here, Dr. Harry Collins of Savannah Age Management Medicine. Thanks so much for joining us, Dr. Collins.
Oh, Natalie, thanks so much for coming to our office. Welcome.
Well, I'm so happy to have you here on the Southern Scene because, you know, a lot of people are getting into this age management. But for some of our viewers out there who are not familiar with what that's all about, because it's kind of a new thing. I mean,
it is.
Let's talk about age management. Give me
Sure.
a little bit of a background where that's concerned.
Sure. I'm board certified in obstetrics and gynecology, and for 27 years I did female hormone replacement therapy. For the last 5 years, Natalie, I've been certified in age management medicine, where the medical evidence shows that getting your hormone levels back to the levels of a 25 or a 30-year-old is optimal for your health. As we get older, we lose about 2% of our hormones every year after the age of 30.
After the age of 30?
Yeah, I'm 66. I've lost 70% of my hormones. But I'm walking around with the hormone levels of a 25-year-old.
Well, and you have incredible energy,
thank
and
you.
you know, and
I feel good.
I can't even believe, you know, that you just said how old you are, and you don't look your age at all.
Oh, you're wonderful. Thank you very much. Thank you very much. But that's kind of the basis, the scientific basis of what we're doing. The evidence says getting your levels back to the levels of a 25 or a 30-year-old is optimal for your health. You feel good, you look good, less fat, increase lean muscle, sleep better, sexual libido, quality and quantity of erections, thinking clear, short-term memory, more energy, more stamina. But what the medical evidence also shows is what you can't see, that it markedly decreases your risk factors for disease in the future. Cardiovascular disease, diabetes, dementia, Alzheimer's, and even cancer. So I want all of my patients not only to look good and feel good, but my job is to keep everybody out of the nursing homes.
You know, many times the doctors will go over the lab results. Sometimes they don't.
Right,
If there's not a problem, they just don't.
Right.
And that means that you're at a normal level, I guess.
Sure.
But there's a difference between normal and optimal where you're concerned.
Exactly. And normal is exactly where you don't want to be. Again, who wants the normal levels for a 65-year-old, 66-year-old?
And I want you to say that one more time, because just when you get those lab work and
Right.
and you know, and you are at a normal level,
Right.
you're saying that's not where you want to be.
That's not where you want to be. When you go to the lab, you give them your date of birth. And on the right-hand side of the lab report, it's going to give me the normals for your age. And I'm going to tell my patients what the optimal levels are for a 25 or a 30-year-old. You need to remember that normal is nothing but an average of the population.
But this is stuff you need. You need
do.
in your body, and when it becomes depleted, you can't operate at your optimum level.
No, exactly right. Exactly right.
Okay, so someone comes to you and they say,
Sure.
you know, Dr. Collins, you know, I don't have the energy that I used to have. You know, I just don't feel right anymore, and I don't know what's going on with me. I mean,
Sure.
What would you do?
Well, first thing we do is labs. We get a complete comprehensive lab panel. I'm looking at all of your hormones, all of your cardiovascular risk factors, and all of your organ systems. The lab will fax it back to me, and I'll give you a call and we'll discuss all this. Again, I'm going to give you the normals plus the optimal values. Then if you want to become a patient, we'll send you out a comprehensive health questionnaire. I need to do my homework and know all about you, past medical history, past surgical history, allergies, medicines, lifestyle, exercise, nutrition. And then you'll come in, Natalie, and it's about a 3.5-hour comprehensive evaluation. We go over all your medical history. I want to visually show you your labs and what you're deficient in, write out all your prescriptions for you. I've got about a 25-minute video that I got when I was at Synagenics Medical Institute, where I got trained in age management medicine, and it's on nutrition, it's on the glycemic index.
Okay.
I don't want to change your lifestyle, I'm not a weight loss doctor, but people that are overweight, they're going to lose some fat and gain lean muscle just from the hormones themselves. So I want you just to watch that 25-minute video on nutrition. We have 2 or 3 exercise physiologists that are part of the practice. They'll spend about 45 minutes to an hour with you. They'll do a BMI, they'll do fat and muscle percentages, counsel you on nutrition, counsel you on exercise. I do a complete comprehensive physical exam from head to toe. Skin cancer, head, eyes, ears, nose, throat, heart, lungs, abdomen, breast exam on the ladies. Don't do a pap and a pelvic. Check a man's prostate, make sure there are no testicular tumors, make sure there's no blood in the stool. And then I want to sit down with you and talk to you about vitamins and nutraceuticals. I'm going to recommend about 7 or 8 different items that I'm on as a patient. One of them, probably the most important, is vitamin D3.
So vitamin D3.
Vitamin D3, much more important than just putting calcium in the bones. Prevention of cardiovascular disease, diabetes, dementia, Alzheimer's, cancer, makes you feel good. You always want to take the D3 when you go to bed at night because it's a stress reliever. It helps you get a good night's sleep. We're all deficient in that. Have you heard of CoQ10?
CoQ10. No, that's a new one on
There's a lot of advertising on the internet and a lot on television. A lot of doctors or medical practices claim to have a better CoQ10 than the next guy.
Okay.
The CoQ10 is an enzyme that comes from the mitochondria of every cell in our body, which is the battery. And it goes downhill after the age of 30 also, but it's necessary for energy.
Oh.
So you want to take that in the morning. It's an energy booster. And we're all deficient in that also, usually after the age of 30.
And you said, and the name of it again is?
CoQ10. It's big C, O, big Q, 10.
CoQ10.
You can buy all those across the counter.
Okay, so vitamin D3,
Yeah.
I mean, all you
Right.
viewers out here
Right.
on the Southern Scene, vitamin D3 and CoQ10.
Right. And a high-grade quality marine fish oil. These are three of the big ones.
Marine fish oil.
I always tell my patients...
Those are your omegas, I guess.
Omega-3s.
Yeah, the
exactly right.
omega-3s.
Yeah, I always tell my patients, this is one of the things I'm a stickler on. If it smells fishy, if it tastes fishy, if it makes you burp, go somewhere else and get it. Okay? But it's really important. You need a minimum of 5,000 milligrams a day.
5,000
5,000.
of the omegas.
Of the omegas.
5,000.
That's going to raise your HDL, the good guys, lower the LDL, the bad guys, lower the triglycerides, hopefully keep our coronary arteries clean.
You know, you hear all of these things about pharmaceuticals now, and they're trying to get away from that, so they're looking for the next best thing, you know, and something that's natural.
And you're right.
You know, but you still, even though you go that route, you still should talk to a physician.
You're exactly right. For example, vitamin D, you can overdose on D. I start my patients on 10,000 international units a night before they go to bed, and that sounds like a lot because the majority of the tablets that you get over the counter are 1,000 milligrams, but you need a minimum of 10,000 to really have any effect on longevity and your health span. But anything more than that, I have a couple of my patients that have a low immune system. They're taking 15 to 20,000 a night, but I'm monitoring their levels. So you're right, you can overdose on D, for example. So you're right, you should talk to a physician first before you start any of that.
Okay, well the next time we come back, I want to get into the bioidenticals because it's not just for women anymore, is it?
No, not at all. Not at all.
We're going to be talking about and showing how many things that you're prescribing are helping a lot of men out there.
They're coming to see me first. And then the guys are going home and they're looking great, and then their wives are coming in.
Okay, well we want to thank you for joining us here
it's
on
been
the
my pleasure.
Southern
Thanks
Scene.
for coming to our office.
Okay, thank you so much. If you'd like more information on Dr. Harry Collins, all you have to do is go to the website you see right there on your screen. You'll find out all the information that you need to know. And be sure to tune in next time because we're going to find out more information on Savannah Age Management Medicine. We're going to talk about bioidenticals, our next segment. So don't go away. We'll be back right after this.